Good afternoon. I'm Becky Dunnigan, and with me is Assistant Director Angie Newcomb. And Misha may be joining us at the Capitol, but what I wanted to let you know is that we have Dr. Patil. He is the Medical Director from Infectious Disease from the Arkansas Department of Health that's going to be joining us and going to be helping educate our staff, all of you on the call. This is being recorded. So if you have staff out there that could not join us now, make sure that it will be recorded and be sent out. However, I wanted to let you know that I did get a message from Dr. Patil. He is running a couple minutes behind. So just bear with us and give us a couple more minutes. And Dr. Patil, from the Medical Director from Infectious Disease, Arkansas Department of Health, will be joining us to help educate us all and answer some of our questions, okay?
Good afternoon. This is Naveen Patil.
Thank you, Dr. Patel. And you are now on with about almost 300 staff from across the state, Division of Children and Family Services. Thank you for joining us, Dr. Patel.
Thank you. I hope everyone can hear me loud and clear. And I have with me in the room, although you can't see, is Dr. Priyanka Thapa. She's a infectious diseases fellow at UAMS, and she's rotating with us in the health department this week. So I thought, she could just hear on and listen to what's going on with this. So, do you want me to start off?
Yes, Dr. Patil, I'm just going to turn it over to you, and if you would start, and then if you would answer a few questions if we have questions at the end, if that's okay.
Okay, that sounds good. So I don't know how many of you had a chance to tune in to the governor's conference a few minutes ago. You all might have heard that as of now, today, we have 6 cases of presumed coronavirus in the state. We had 1 yesterday, and we had 5 more cases overnight, and we have total of 6 cases now within the counties of Pulaski, Grant, Jefferson, and Saline. So that's the latest update on this. So I want to make this my talk on this pretty simple in layman terms, and what I've been told is most of you are non-medical personnel, although you kind of do some sort of healthcare work, if I could say. Most of you are social workers or psychologists, child psychologists. So I'll just give you a quick overview about coronaviruses. So coronavirus is a large family, and basically these viruses are found in bats. And there are several of them, maybe almost 100 different types of them in bats, and they're kind of closely related. The problem happens when they switch species, when they go from being from the bat to another animal or to humans. So this is not the first coronavirus problem we've been having. We've had 3 similar. This is the 3rd one, actually. The first one happened in 2002, 2003. It was called as severe acute respiratory syndrome, or SARS coronavirus. And that basically, it was a short-lived epidemic, lasted about 9 months, and we had about 8,000 cases with about 800 people dying. That is about 10% of the people who got it died. The next one, which is still ongoing coronavirus outbreak, is known as MERS coronavirus, or Middle Eastern Respiratory Syndrome. Middle East because of the geographic location from where most of the cases occurred. So to date, we have about 2,500 cases, and about 800 people have died. So it has a higher mortality of 35–40%. So of 2,500 people, 800 people have died. So it kills about 1/3 of the people. And that epidemic is still going on, and every year we have almost 100 cases. The reason it's going on because it's originally in bats, but it has found kind of a intermediate host in the camels. So it's in the camels, and because humans and camels are in constant contact, it keeps on transmitting. Transmission is going on. This third one, as you know, originated again in China. Two of these three, SARS and the current one, COVID or SARS coronavirus 2, originated in China. So this one also originated most likely, went from maybe a bat to some other animal, and then, switched on to humans. So right now we have about almost 120,000 cases and about 4,000 people who are dead. So if you see the number of cases affected and number of people who have died, the mortality, that means about 2% of the people who get this usually die, compared to 10% for SARS coronavirus and 35% for MERS coronavirus. But the transmission is much more common. So I'll just give an example. With influenza, if one person is sick, they can transmit it to one person. With the current one, if one person is sick, on an average, they can transmit it to 3 persons. We still don't know exactly because it's just the beginning of the epidemic or pandemic. But the studies have ranged anywhere from 2.5, 3 to almost 7 or 8. So one sick person can transmit anywhere from 2 to 3 to 8 persons. So the transmission from one person to another person is much more in this than other viral diseases, other diseases that we know of. But one good thing to know is among all the coronaviruses, whether it's SARS, MERS, or the current COVID-19, children are rarely affected. Less than 2% of cases are children, and most of the cases in children are very mild, with very few deaths in children, not only currently, but also in the past. We have limited data now because this is ongoing. But even if you see of all the 120,000+ cases we have, 80 to 85% have very, very mild symptoms. They might just be having, a kind of a sore throat, a mild cough, those kind of symptoms, some body ache, some mild fevers. Most of them have that. About 10 to 15%, have more serious illness. They might have a pneumonia, more cough, fevers, body aches, and all that. But most of these severe cases are also do well. It's the critical ones, about 5% of people who require care in the ICU, may need a ventilator, and those kind of things are about 5% or less. And again, the overall number of people dying are only 2%. So, even in these 5%, many of them do recover. The people who are more prone are the elderly people above 65 who have diabetes, heart disease, lung disease, those kind of things, or immunocompromised. They have more chances of dying from this disease. So how is this spread? So what we call in medical terms is a droplet. So what happens is, when someone is sick, they cough or sneeze or something, you can't see it, but they have small droplets that are known as droplets. So it goes most about 3 feet from where the person is, and then it hangs in there. If someone's there, you are exposed to that, or if there are objects or something like that, it lands on that. So the only way you can get it is if you are around a sick person, standing there close by, and they cough or sneeze on you, and you inhale those droplets. That's one way. Or if sick person was there and he has coughed or sneezed, or he or she has coughed or sneezed and gone away, and he coughed on a table, on a mouse or computer or something, and you go and touch that, and then you after touching that, you have the virus now on your hand, and then you inadvertently go and touch your nose, touch your mouth, touch your face, touch your eyes, you get transmission from there. So basically, if someone coughs or sneezes on you and you're close by within 3 feet, that's one thing. And second is by touching an infected area. Again, this is a new virus, so we don't have much data on how long it can survive. So in the previous studies of coronaviruses, some viruses could survive only for a few hours. Some of them have survived for a week. For this particular one, we don't know how long it's going to survive. And again, to survive also, It should have a good surface like glass or plastic, and it should not be exposed to light or ultraviolet rays and those kind of things. Too much heat will kill it. So those are the kind of things. So there are a lot of moving parts to this also, on how long the virus can survive and under what circumstances. So the best way to protect yourself, let it be anyone, whether you're a healthcare worker or a common citizen walking around here or there, the best way to protect yourself is by washing your hands as frequently as possible. You don't have to shake hands with someone, you don't have to hug someone or anything like that. You can just wave your hands or just say hello, and after every contact, you might have washed your hands well, you don't know what the other person has done. If you have to touch him or something like that, wash your hands again. So that is one precaution. The other precaution is, if you know someone who is sick or anything like that, stay away from them. Maintain your distance, social distance, 3 feet, 4 feet, 5 feet, around that. The other thing to do is, if you are sick, if you are having fevers, if you're having, scratchy throat, cough, and other things, stay away. Don't come to work. So these are some of the easy ways that you can. And again, if you can avoid a social gathering, don't go if it is not needed. So these are some of the simple things that you could do to help and protect yourself. So as I said, I'm going to keep my talk very simple, and I just wanted to give a basic overview of things. And I know if you all have questions, I'll be able to answer any questions. No question is silly. No question is simple. We are here to help, and don't hesitate to ask any questions.
Okay, Dr. Patel has opened it up for questions, but how we're going to have to handle this, because Dr. Patel could not join us live Zoom, he's by telephone, is Angie's going to read your question to Dr. Patel, and then Dr. Patel is going to answer the questions. Is that okay, Dr. Patel?
Yeah, that sounds good. And if audio is not good, what I would suggest is just text me also the question, please.
Okay.
Okay, so one of the questions is, I guess it was some of the statistics that you were giving, was that 130,000 across the U.S. or was it worldwide?
No. Yeah, it's about 120. I don't know the exact count as of now. It's about 120,000 or something like that, and that is all over the world. It's in over 100 countries, and in the U.S. it's about 1,000 cases, and we have about 30 people who have died.
Okay. The next question, and most of this is our field staff out there across that do a lot of home visits with families. We have a question as far as home visits. Should we start wearing masks? And if so, what is the best kind to wear? And I know Becky can also follow up with a little bit of information maybe on that piece as well of what we're working on right now.
So again, from what I understand, I spoke with Becky, and the type of care you do and provide and all that is pretty low risk. We do not have community spread of this virus yet. And again, these are people who are mostly at home, and I do not anticipate this as a high risk exposure. So what I would suggest is, every time you visit someone, wash your hands and all that, and at the end of the visit, again, wash your hands and do that. So to be on abundant precautions, if your agency is able to provide you with masks, and even if it is simple mask, you can wear a simple mask if that's all you could get instead of N95. N95 are usually fit tested, but some of the other ones are okay to provide some sort of benefit. But if the simple surgical mask is all that you have or you could get hold of, and Becky told that you still are working on that logistic, right?
Yes, we're working on mask and gloves, and we'll keep the field staff posted on that.
Yes, I mean that would. And in the meantime, just washing your hands, before every contact, after every contact is what I would suggest you do. And not only while seeing your patient, but also when you go back home, and when you go to Walmart or go to Dillard's or whatever it is, finish this thing. If anytime you eat or touch your face or mouth or whatever it is, wash your hands.
Okay. So with that being said, though, will Germex do the same thing? Because, getting in your car once you leave a home from doing a
Yeah.
home visit, would Germex work as well?
Well, I wouldn't say Germex or, Lysol or Clorox or whatever it is, as long as it is 62% alcohol or more, that should work. And again, you put good quantity in your hand, sing happy birthday twice, and move it all around your hand, cover to your fingernail, back of your hand, and, if it's still wet, dry it out. It has to dry out. You can't wipe it to any cloth. It takes the whole point away. Make sure you rub it so long that everything dries away.
Okay, sounds great. Okay, so next question. What if we are workers with an autoimmune disease making us one of the at-risk groups?
It wouldn't. You mean your employees with this thing, immune compromised diseases? You're talking about your workers.
Yes.
Yes.
So I would still say you still take the same precaution. Again, we don't have as of now, community transmission that we should be worried about. We are still at a low risk. The environment you are all working is still at low risk.
Okay, somebody also asked, they just wanted to confirm that this originated from animals or birds specifically?
Okay. Most of the coronaviruses are all found from bats, originated in bats. We don't have exact this thing for this current coronavirus, but we are assuming that it originated in bats. The previous one, SARS and MERS and all that, we have good data that they started off from bats. Then they jumped species, that they moved on to a different mammal. Like for SARS, it was a mammal known as palm civet. For MERS, it was the camel, and then it transmitted to humans. So now we have human-to-human transmission going on.
Okay, one of the other questions, how do we protect our families after visiting other families? So I think that's when they go home. What are some of the things that they could do just to make sure that they're trying to protect their own families?
Okay. So as I said again, the population you are serving is low risk. There is no ongoing community transmission as of now. So what I would suggest is, if you're not taking care of sick people and all that, washing your hands, there is more chances of you taking other bugs like, drug-resistant bacteria or flu and other things back to your family than the coronavirus. Okay? So right now there is not. So you are in a kind of a unique situation. If you are a healthcare worker and you are taking care of patients, or including coronavirus patients in the hospital, you would have a mask, you would have a gown, you would have a gloves, and all that you had to do is, take those things off and make sure you're clean, and then go home in the same clothes. It should not have. But you are in a kind of a unique situation. You don't have access to gowns, and you're not actually doing patient care work. So right now, again, I wouldn't be worried about that right now. What I told and I said in the beginning, you need to have a symptomatic patient who is coughing or sneezing, and have to be around 3 feet from you for them to have that droplets fall on your clothes or on you.
Okay.
So again, washing hands is right now. If your agency is able to provide the mask and gloves and all that, wear them. Wash your hands, and wash your hands repeatedly before seeing, after seeing your client, and even before going home.
Somebody also asked, where are the 6 confirmed cases, which I don't think they're confirmed right now.
They're presumed cases, and most likely, our lab is pretty good. So this is a new test, so we just have to go through the process and all that. So from the data we have no reason not to believe that these could be confirmed. And confirming it would take another 3 or 4 days from CDC. And I told the counties are Pulaski, Saline, Jefferson, and Grant.
Correct. Okay. Somebody also asked, what are some of the symptoms to look for? And then if you're feeling feverish and sick, do you recommend going to the doctor or just treating it like the flu?
Okay. So a few things. Still common things are common. We still have a lot of flu going on and a lot of respiratory viruses going on. So they would still also be high on the diagnosis rather than the coronavirus. The symptoms, I'll tell you, with the flu, body ache, fevers, not feeling good, headaches and all that come pretty much rapidly within a day or two. With coronavirus, the scratchy throat, cough and fever and all that may take about 5 days. The average is about 5 days. It can come on 3 days, but 5 days. So it's a little bit more gradual in onset than the flu. And if you right now, if you don't have a history of travel and a history of known exposure to a case, if you don't feel well, if you start getting fevers, isolate yourself and call your primary care provider. Let them do the usual testing of regular viruses and flu and all that, and then maybe they can consider coronavirus testing. But things may change in a few days if it becomes a little bit more widespread in the community. Maybe at that time we can instead of checking for that, we could change our modalities. This is a kind of a very fluid and evolving situation. What I say today may not be valid next week.
Okay.
But right now, if you don't feel well, stay back at home till you are fever free and are doing okay.
Okay. What about immune vitamins? Will they help, and should they wear gloves?
I think I answered the gloves already. I'm like, you guys are providing gloves and this thing, so that's fine. But if wearing gloves doesn't preclude you from washing your hands. And vitamins and all that, there's no proven benefit with that.
Can the virus live on clothing?
Yeah, we don't know how long it can live and all that, but they can live on surfaces. And again, as I said, the questions that we get is many of our products are shipped from China, and can the viruses live on that? Again, I told you, they need some of these viruses require good surfaces, like I said, glass or plastic with no ultraviolet rays, adequate temperature. There are a lot of things it's dependent on. Yes, if someone coughs or sneezes on you, it can fall on your clothes, and it can be there. But whether it can be transmitted, how long it lives, we are not sure. But if you want to wash your clothes, regular washing with in your washing machine should kill it.
Okay. If visitors come to the office and have just recently visited Australia but have been quarantined for over 14 days, can they
You don't have to worry. Yeah, if it has been more than 14 days since they come back from those affected countries, you don't have to worry.
Okay, good. Have the individuals that have been confirmed to have this virus been quarantined?
Yes, ma'am. The people who have been confirmed or presumed confirmed, they have been quarantined. The contacts to them have been quarantined. That's the job of the health department and all the others involved. So we are very, very vigilant on that. So the contacts, everything has been have been quarantined. And again, I'm sure the press conference of the governor and Secretary Smith and other people involved should be there on YouTube. You can watch in detail all the other things that the state is doing to take care of its citizens.
Okay. One of the things is we have families come in and out of our offices in the different counties where they have like a visitation between parent and children. What's some of the things that we could do to make sure that our visitation rooms where our families play in and interact in stay sanitary?
Well, if the patients are not symptomatic, you shouldn't be worried. But, just like hospitals and other things do, if you have Clorox or Lysol wipes, please wipe the surfaces and keep them clean. That's all I would suggest. And again, on top of that Lysol or Clorox, it will tell you, how many minutes you need to leave that on, 2 minutes or 3 minutes or whatever it is. That surface should stay wet. You can't wipe it and sit down there within the next minute. Or it will say usually 2 minutes contact time or 3 minutes contact time. So you wipe it. After that, you have to leave it for 2 or 3 minutes, whatever time is written on that, and then it can be started using. So that's the one way of cleaning those surfaces.
Okay. hold on, I'm trying to read on some
No,
of
take your time.
because some of them I think we can actually look at and maybe reach back out to some that are specific. Okay, there's and really we know it's not a confirmed case yet, but there's a case at Children's Hospital medical worker in Little Rock as of yesterday. I was at that facility Friday. Should I be concerned?
So the children's hospital people will contact how it works. If you are just walking past it, you are not at risk. As I said, it has to be close contact, 3 feet. The patient would have been sneezing, coughing, talking, those kind of things. So the children's hospital will figure out who the closest people were to them, and then contact test the closest people. And if they have not been contacted, that means right now they are not in the circle of suspicion.
Okay, hold on. Is testing for the coronavirus the same as for the flu?
I didn't understand. So yes, it is done like the flu. You take a swab from your either nose or throat, but it's not the same test. So, but you take the swab in the same way, put it in an appropriate tube and medium, and then test it. And again, if people who meet the criteria and all those other things, they can, their providers can get them tested from private labs. The health department is now concentrating on cases and their immediate contacts to test at our lab.
We have staff that actually collect urine samples to do drug screens.
Yeah.
One of the questions is it something that they should be worried about when collecting those?
No, I wouldn't be worried about that right now. As long as they practice good hygiene, wearing gloves while collecting urine, putting in the cup, putting in the plastic bag, whatever, how you follow the procedure and washing your hands again, that's all I would be concerned about now. And again, the transmission, right now there's no community transmission. The kind of patients you're taking care do not fall into that category. I would not be worried about that right now.
Okay.
Yeah.
Can this affect an unborn child?
So we don't have any data on this virus, but a few studies on I think almost 100 patients who were pregnant from China said that there were no adverse effects of this coronavirus in the moms. And again, as I told you, it's not only this coronavirus, even the previous coronavirus, the amount of children who have been affected by this have been minimal, and even the diseases that they might have spectrum have been minimal compared to the elderly people. So we have limited data on this disease for us to know so far.
Okay. And how is this being treated?
Well, unfortunately, there is no known cure for this or treatment for this. So it depends on the severity of the condition. As I said, about 85% of the people recover by themselves. The 10 or 15% who are severely ill and 5% who are really critically ill may need treatment. The treatment which we usually offer is, if the kidneys are not working, we give fluids to keep their kidneys, give them glucose, stabilize their blood pressure, and those kind of things. And there are a couple of drugs that are being tested. And if you want to give those, if the doctor, it depends on the doctor who is treating. If they feel comfortable giving those tests, they have to be enrolled in a clinical trial and get those drugs and do it. Again, there is no data for that. So most of the treatment is symptomatic based on what's in, if you're having fever, you give, medications to keep the fever down, keep you well hydrated, keep your kidneys going, and those kind of things. Okay. And most patients have recovered. Many people have recovered and done well.
That's most of the questions that I feel like we should, just ask on here. There's some other questions I think it's more for us to answer. We will be getting those questions answered and sent out to everyone.
Okay. Thank you, Dr. Patil. We appreciate you taking the time to talk with our staff.
Yes.
Sure, no problem. And again, I would not, reiterate this more and more often. Wash your hands after touching anything, including your patient, before you touch your patient, after you're touching your patient, before eating, every time. Keep washing your hands. That's the best way. Sometimes these are the times we need to learn. We need to make a habit that, we need to wash our hands every time, not just during times of crisis. Every time, we need to wash our hands and do that. I would like to reiterate again that, we are still in a low risk environment. There is no known community transmission. All the cases that have been exposed to one or other cases. So right now things may change, but right now we are still low risk, and the chance of getting this is much lower compared to other viruses or flu that are floating around in the community.
Right.
So if there's anything else, you guys can, text me or reach out to me, and I can answer those questions later on.
Okay, great. Thank you, Dr. Patel.
Thank you all.
Okay, thank you. Okay, I think this concludes this Zoom section, and Misha talked earlier and said that we'll continue to keep you updated as we hear information. And you can always send questions to either Angie, Misha, or I, and we'll try to get any answers we can to you.
Yes.
Thank you. Have a good day. Wash your hands.
Yes. Thank you.